Okay, I'd like to call to order this meeting of the Assembly Housing and Homeless Committee. It is Wednesday, September 17th at 2 p.m. Let's start, if we can, by going through the members who are in attendance.
Aaron Baldwin Day.
Jared Kirker. Christopher Constant.
Cameron Perez Verdilla.
Yaro Silvers.
Okay, and it doesn't look like we have anybody on the phone yet, so we'll wait to see there. Okay, great. Let's get started. We first on the agenda have the mayor's office and the Anchorage Health Department. If you guys want to get us started.
Great. Travis, can you hook me up? Okay, great. Thea Agnew-Bemben, Special Assistant to Mayor LaFrance.
Kimberly Rash, Anchorage Health Department.
Great. Well, thanks for having us today. We wanted to give a little bit of a kind of overview and update so that you have the most kind of comprehensive and up-to-date information as we walk into budget season, which of course we're all preparing for. So we're not giving any like budget updates right now, but just trying to make sure you know what are the things that we're working on that will be included in our 2026 priorities. So our success measures are really the same as they have been really since the mayor took office. We want to have more housing, better shelter, a lot fewer people sleeping outside, and a safer community for everyone who lives here. And I also would add to that, we have a priority around leveraging additional funding and funding from other sources and bringing a lot of partnerships in, and also providing better transparency when it comes to data and reporting back to the community. So our first part that we want to update you on is our year-round coordinated safety net shelter system. Sorry for all the adjectives. We are working on a graphic. You can see a picture of it here to help people really kind of see the system that we're building. The important sort of aspects of it are that it is a safety net. So it really is, I think the metaphor of a net is a really good one, because we're trying to knit all the different parts and people and places together. And we also want it to be well integrated with our crisis response system, because oftentimes what happens in low barrier shelter is it's low barrier. It's kind of where people can get into, but oftentimes what that means is that people with very acute needs are in our low barrier shelter, which isn't necessarily staffed for that. So it's really important that we have a robust and functioning crisis response system that can really support people who are in crisis and also experiencing homelessness. So making sure those two things are really connected is a big part of our priority. I'm going to talk about this a little bit later, but one of the things that we're working on is with the HOPE team. The HOPE team has been operating since last summer. It's been an amazing, wonderful addition. Ruth and Tanya are here today. One of the things that's happened as they do their work is they've really gotten a lot of organizations and partners wanting to do the work with them, which of course is fantastic. So they've been really bringing these partners into the outreach that they do. And now what we'd really like to have is a kind of home base for them. So we want to really build on some of the other resource and navigation opportunities. Third Avenue Navigation is one option or one location, and then Beans Cafe is another. So we want to create a kind of hub where people who are coming to those places can easily access all of these different partner agencies, and that we can really make sure that as we do outreach, we're coordinating and really leveraging all those partners. So that's one thing we're working on right now. The mobile crisis team has been working towards being 24/7 for quite a while, and they're right on the cusp of it. So that's really exciting. Coming off of the pilot project that we did this summer, where we ran a second team and did a lot of assertive outreach in the community, we'll be really incorporating that approach into the 24/7 model. So it's going to be a real addition, or a really beneficial addition, to have them especially operating at night 7 days a week, because during the night is oftentimes when things happen and we need their support. The police department has been presenting to you already about their impact teams and continuing to build out the mobile intervention teams. So I won't repeat that here, but just to let you know that that is really well integrated with our other outreach and crisis response teams. And then another thing we've been working on that you've heard us talk about, so I don't need to go into detail, but just to let you know, it's really bearing fruit, is with the safety patrol and the safety center. We've really changed the criteria for who they can serve. So now if someone's voluntary and wants to go to the safety center, they can go there. They don't have to be to the point where they're put under an involuntary commitment to get into the safety center. And then they also can stay there longer. So it's allowed people to sober up more. And then we have our community resource connections happening right there. So it's really led to a lot more people going from the safety center into detox and treatment or into other community resources, which is great. We're also really interested in increasing our efforts around diversion. And what diversion is, a little bit different from prevention. Prevention is when somebody's housed, we want to prevent them from becoming unhoused. But diversion is when somebody shows up in our system, if we can easily kind of move them out, whether that's connecting them back to family and friends, connecting them to treatment, connecting them to employment and housing that they can afford, we want to make sure that we're doing that. So I'll talk a little bit more about some of the ways that we're doing that, but we're really increasing that through our coordinated outreach and through really connecting with other partners and supports. I'm going to hand it over
Let me pause you for a second. I'm
Yep.
got a quick question for you, and then you can hand it over. So,
Okay.
Ms. Silvers.
Yeah, I know the Navigation Center has a shuttle. And so you're talking about having like a hub of services at the Navigation Center. As a part of that, would you look at not duplicating services across different shelters? And so it's a little bit more economical to just have those services based out of the Navigation Center?
We're not, so what we're talking about is really, so the Navigation Center at Third Avenue is already a hub, like you said, and already has providers there. What we're really wanting to do is kind of between Third Avenue and Beans, really embed the Hope team more into that and embed their outreach providers. So it's really kind of expanding on the concept that's already there. And part of the purpose of that is that when we're doing outreach and we connect with someone in the community, instead of just trying to kind of case manage out there, we can then bring them back into that hub and connect them with the partners that they need to connect to. So it's not so much changing what's happening right now. And I think in our shelter sites, we have case management, we have some basic health services, but it's kind of the first level. So at Third Avenue Navigation at Beans and with the Hope team, we would be doing kind of more robust connections. So it's kind of what's happening now, but it's more just adding the Hope team into that mix. Yeah.
Yes, Mr. Constant.
So is Beans actually providing services at the Navigation Center now?
They don't provide services at the Navigation Center. No, they're just located just up the road. They're still doing food and employment and all the things that they do.
They are, okay. It's
Yeah.
like
But they
checking out
have
their
some extra
website.
space. So they're
Yeah.
just, both places are really interested in having the Hope team there more. So we're kind of working towards the two locations.
Ms. Baldwin.
Do you happen to know if the Third Avenue Navigation Center has plans to increase their provider presence as sort of in tandem with the Hope team being more present more frequently?
Yeah, that's part of what we're trying to do. So we would like to have longer hours and more providers there. So yeah.
Great.
Yeah.
Great.
Yeah, just one other quick question. I'm curious about the safety center and where that fits in that. Would you consider it a shelter?
No,
Does
It's
it
not a
have-
shelter. It's
not a
crisis
shelter.
response.
Okay, but someone can go there and get out of the cold and they can sleep there. Is that right? So
So people can sleep there. So now that we've kind of broadened the criteria, what used to happen is, because we would only take people who could be titled, that if the safety patrol came upon someone, say it's, winter and someone is asleep outside, they come upon them, they say, hey, how you doing? And that person's like, oh, I'm doing all right. There wasn't an option for that person to say, hey, I'd like to go indoors and sleep right now.
Right.
Because if they weren't incapacitated, we wouldn't take them. And so now what we're doing is, in that situation, they could say, hey, would you like to come inside for a bit? And they could come. And so we're figuring it out right now, how that's going to work operationally. I think anytime you have a mix of voluntary and involuntary in a location, which is pretty common, you have to make some triage decisions. So if it's crowded in there and someone's in there voluntarily, they're probably going to have to leave for more people to come in. So that'll be an operational question that the safety center and AFD will work on.
But that's one of the changes is if someone's outside this winter and they don't want to go to a shelter and they don't want to, but they're cold and they need to get in someplace warm, this is where.
I would say if they are in a crisis situation. So to me, in the middle of winter, that's someone sleeping on the ground when it's cold.
Okay.
And if they wanted to, and there was room. So yeah.
Great.
Mr. Chair.
Ms. Silvers, and then go back to Mr. Constant. Go ahead.
Yeah, when your COC contract renews, can you put some provisions in the new contract to have them revisit the coordinated entry system to include some of these things that you're talking about, like greater coordination, diversion, metrics of engagement, some of that stuff, instead of just the straight time on the streets that is happening now with coordinated entry?
So two things there. We did just have a conversation this morning about ways we can better measure diversion. So that's something we're certainly working on in terms of our data. With coordinated entry, I think what you're speaking to is the criteria that we use to prioritize people on that list. And that's certainly, so both Kim and I have different functions on the COC, so we can certainly bring that to that group.
Yeah, thanks. Back on the sleep off. Can you share with us when you get a chance, this new entry criteria?
Mhm.
Thanks.
Yeah.
When was that updated?
We've been kind of piloting it during this summer pilot period, and just like as of like 3 days ago, we're starting to kind of write it down. So we're not quite there yet.
What do you anticipate the capacity will be?
The physical capacity of that building is supposedly 50, but really it's about 25 to 30 just from a programmatic standpoint.
And that's including individuals who are at the Title 47 level and others, that number.
Yeah, that would be for the number of participants that could be there at a time.
Yeah, so definitely you mentioned kind of offhandedly that it's space available. That function is very essential. It's constitutionally mandated. So we want to make sure that there's also a plan to move people who might just be there because it's cold, but who aren't the essential service recipients of that program. People who are, kind of under that Title 47. mandate.
Yeah, I mean, we can talk more about it. I think the program has been around for a long time, and there's already been some evolution over time, and especially as it's moved from the health department to the fire department, there's already been quite a bit of policy change.
Right. So I've been participating in it since it was part of the Anchorage Downtown Partnership. And so for many, many, many years, and I've seen the evolution, and I know why it started. And it started because we had people drinking themselves to death on the streets. And so I want to make sure that thread stays primary.
Oh, yeah.
Yeah.
Yeah. Great. And
Sorry. Ms. Baldwin.
I'm curious if that function with the safety center sort of acting as another conduit into detox treatment, those kinds of things. Is that something that we expect will continue sort of in perpetuity, or is this a little bit of a stopgap measure until we have like the new crisis care center in place?
yeah, once crisis stabilization is open, I think that's going to really, we're going to need to do some thinking as a system about who goes where, because some people who are currently served at the safety center can be served at the stabilization center. And those are criteria that are being developed and will have to be refined with South Central Foundation and Providence. But it certainly will change the character of our facility.
Sure, and
Yeah.
where people can go when, okay.
Yeah.
Wonderful.
Yeah.
And then just a technical request, I guess. The document that's there to the left, that is the illustration of the safety net and crisis system. Is that document available somewhere as a PDF?
Not yet, but it will be, because
Excellent.
we're just still working on it. But
Okay.
I mean, we're almost ready to share it. We just have it has a page 2 that has addresses, and we just need to make some corrections. But
Super.
Yeah.
Okay, thank you.
okay.
All right, I'm going to talk about our congregate shelters. I want to first say this is the first time in a while that we've actually had everything in place before October. So that's pretty impressive. I'm excited about that. As of 8/31, Henning took over at East 56th Avenue. They maintained 200 individuals until September 2nd, when Linda's Place, which is located at 1911 East 5th Avenue, was able to come online. So from September 2nd to September 4th, the East 56 decompressed from 200 people to 100 people, and we increased capacity at Linda's Place. Both East 56 and Linda's Place have maintained full capacity since opening up. They are both, the transition itself went very well. RRS was a piece of that puzzle and making sure that individuals were surveyed on who would want to go. So individuals were not forced to go from one location to the other. It was voluntary. So that transition went really well. Linda's Place has recently opened up the 3rd floor, which is exclusive for women. And so they're able to offer accommodations for 29 beds up on that 3rd floor. And East 56, there has been a positive change in the routine. Guests are engaged and asking for help. Guests are returning on time per head counts and are often in their cots by 11 p.m. There's been a decrease in loitering in the area and less trash on the grounds. The perimeter checks at East 56 extend all the way down to AIH. And there's been a positive neighborhood relations being reported. As of August 31st, 3 people were moved to housing, and people seem to be receptive to hearing about treatment options. Alex Place has remained at capacity since July, and that operation is just moving along very steadily. Guests are engaged. They did recently change the attendance policy, which began on August 27th. So instead of flipping beds every 3 days, they flipped them every 2 days. MASH has been able to have 6 individuals housed in July. 8 individuals were housed in August of 2025, and then they're on track to be at 10 individuals for September. So overall, all 3 operations are working very well. They're working in coordination. And as you can see with this graphic up here, it's really being coordinated by RRS and that whole continuum within that blue box there.
I just want to share that the woman that's the manager over at Alex, Suzanne, is that her name? She's been attending community council meetings, and it's been really a positive experience just having her hand out cards and really make connections with the community councils. So just a note. Ms. Baldwin-Day.
Thank you. Can you share a little bit more about what it means to flip beds every 2 days versus 3?
There has been, I think really probably since we started doing non-congregate shelter, a policy that people could keep their room if they missed 3 nights, they would then lose their room, correct? And so what that was kind of leading to was sometimes people would miss 2 nights, come back for 1 night, miss 2 nights. So what we were noticing is we just weren't really fully utilizing the rooms. And so the policy now has changed to if you miss 2 nights, then you will lose your room. And that's not like, like if someone's in hospital or there's other like extenuating circumstances, it's not like, super rigid, but that's the change in policy overall. So we're making sure we're getting full utilization of the rooms.
And is that an Alex policy or an MOA policy or some?
It's a great example of the reason we're doing coordinated shelter, because as a group, because we're often trying to make sure we're maximizing the space and making sure we're troubleshooting as a group. And so really as a group of providers working with RRS, that was determined as a good change.
Can you help? Just another question. When you say they're full, there's another concept there that I think is helpful because if we are continuing to say that all of these are full, which means there's no beds available. That is not what that means. Is that correct?
Correct. That's not what that means. So the beds are turning over, but that every day when they go to count how many individuals are at the facility, it's 100 individuals, but doesn't mean the same individuals are staying there for long extended periods of times. So there are unique individuals circling through that system.
Are we able to track individuals that are not able to get into the shelter? How do we know if if last night, for instance, there was a certain number of people that couldn't get in because it was full?
So those numbers are tracked. How many individuals want to seek shelter and cannot seek a bed within that facility? So those numbers are being tracked. In addition to individuals that are within the facility, they're also tracking how long those individuals are staying within the shelter and really working on the case management piece and working with individuals, which is why one of the reasons why we wanted to go down to 100 individuals at each of the locations, so there can be a little bit more intense case management. And more integration of those conversations and interactions with the individuals.
Ms. Silvers?
Yeah, and so when you say that there's a lot of movement in the system, so if a person comes and they're seeking shelter and it's full and they're not able to get a bed, is that something they're able to come back the next day and get a bed, or the following day? Like, are people waiting a long period of time for a bed, or are people able to find a bed pretty quickly, even if it's not the same night?
I would say so far, within this past weekend, for an example, those individuals were able to find a bed, just not that particular night.
Ms. Walwinde?
Yeah, are those numbers reported anywhere? The number of people who seek shelter but can't access it because the shelter is already at capacity?
So the health department has a daily report. That's a spreadsheet that all the shelter operators fill out, and it includes the turnaways. And so I think that's not a public dashboard, but anytime you wanted to know that number, we could provide it.
And what is that? I mean, is that number relatively static, or does it move around?
It does move around. So I would say, again, using this weekend as an example, over 3 days, there were 75 individuals total over 2 locations.
Okay, and is that, and what is what's, I'm not asking for like very, super specific numbers, but like, what does the range look like of, are we talking about like 15 to 70, or are we talking about 60 to 120? Like, what's the box, I guess?
I would have to get back to you on that. I don't specifically know.
Okay.
Yeah.
That'd be great. I'd be really interested to understand what those numbers look like.
And through the chair, I mean, that number is what we're going to be using to determine when we need to bring on surge capacity. So that's something we need to figure out this month is, like, what's the mechanism going to be? Like, how are we going to get the, kind of authority from you to be able to turn that on? And what are the conditions? How are we going to manage that? So we can come back and talk about that.
Yeah, I think that would be great, because I'm curious about that too, is if it's, and you think 75 people were not able to get a bed. Is that what you're saying?
Correct.
Yeah. So that would be a helpful number, because obviously we want to, as it gets colder, we want to make sure if the people can get a bed. So yeah, Ms. Silvers.
To clarify, 75 people were unable to get a bed the night that they first arrived. Of those, how many do you think were able to get a bed the next night or the following night? And how many just were unable to get a bed, period?
That I do not know.
Chair, would you like to ask Kathleen to come up? Because she probably has a grasp on this.
If you have more to add to that. I mean, I realize we're asking questions that we didn't ask you to bring the data for. So, I mean, we want to make sure that we can gather this information. But if you have some additional information to add, it would be helpful.
Through the chair, I just wanted to make just a deeper dive on the details of the 75. What we do is, if somebody comes into one of the shelters, it's full, we get them into another shelter as a priority. The second thing is, when we track turnaways, that is, if someone calls and says, I want a shelter, or they walk up, and those 75 are not unduplicated,
I see.
there's duplications. So
So those are 75 turnaways
75
total.
75 turnaways, but not 75 people.
Right. Yeah. Okay. Thanks. Well, that's something that we can dig into more later. Thanks for the answers.
Okay, if we're good on shelters, so housing, I'm gonna share a couple specific updates, but just wanted to let you know that we, I think it's actually maybe on the agenda, or maybe it already came from CSD to do the additional home ARP funding. Yeah, okay, so we will be sending forward to you some reallocation of home ARP so that we can extend funding. You'll remember that the ERA2 money ends September 30th, so we wanted to identify the grantees that served the largest number of people who came out of homelessness into that rental subsidy, because they're the ones most likely to need some more assistance. And the home ARP money doesn't have that September 30th deadline. So we are going to be reallocating some of that funding so that for the grantees that serve the most people coming out of homelessness
Programs. I think I'm curious about that other piece that points more towards sustainability, and how do we help households, move from a place where they are in need of rental subsidy into a space where perhaps they don't, and evaluating that on a household by household basis. And I realize that that's a tall order. That's quite a bit of sometimes fairly intensive case management to ensure that families have access to the resources that they need, that they have, pathways into more stable employment or those sorts of things, stable transportation perhaps. But I think if we're going to continue to contemplate rental assistance and voucher programs, that there has to be some kind of connection to like long-term sustainability for households, so that we are patching the immediate need, but also providing a pathway where like the family or the household doesn't remain in that cycle. And so I'm curious what the thought is, or what the plans are in terms of, providing that kind of support for households who are sheltered or are coming out of homelessness, or who have been involved in this rental assistance program to date and are in need of additional support.
Through the chair, I mean, I think that's one of the advantages of working with HFC, because they, for example, they have the returning home voucher, which is for people coming out of corrections, and the data from that program is pretty remarkable, like the extent to which it really reduces recidivism to jail. They also have the moving home voucher, which is for people with disabilities. And so I think we can, and also because we would, be working with the health department and probably specifically like Jed's team, that's where we maybe could consider, like, do we want to put some other like home funds or whatever that can be used for the case management or that type of service, like, kind of partner those two things together. So I think we can totally explore that.
Yeah, I think that's something that feels really, really important to me. What is that total? What's the home ARP that we have available to move into the rental assistance pot?
Home ARP's one time, so it would just be our home funds. We get about 700,000 a year
Okay.
from those. But there's other things we could spend it on. So I think that's again kind of what we would discuss in the budgeting process.
Awesome. Yeah, I think I'm obviously will speak for myself only and not all members, but I think that's something that's of particular interest to me, is ensuring that when we're investing in rental subsidy and voucher programs, that we are doing so with an eye towards sustainability for the family, and making sure that we're asking some of those deeper questions, not just how much money do you need for rental assistance, but also like what other supports are necessary for you to be in a different place in 6 months or a year's time.
Ms. Silvers?
I'm sorry to go backwards. But the 75 number, I think the numbers that we need is how many unique individuals were unable to find shelter anywhere. Because I think if, you have 30 people that were turned down at 2 different shelters, but found shelter in a third location, and you've counted them, 60 times, that's not very helpful to know. I think what's helpful to know is how many people couldn't find shelter anywhere. And then in addition to that, because you said that if they can't find shelter, you prioritize them for shelter. How many people were unable to find shelter anywhere within, let's say, 2 days or 3 days? So we can see like how much movement we actually have in the system and how quickly we are able to shelter people.
Great. And just one other thing around the ARP funds. Just trying to understand, and again, we don't have to go too deep in this, is as we're thinking about keeping people in where they live through rental assistance and other kinds of support services, how much of that work is done by the city and how much of that is done by our partners. And I'm just wondering about the long-term sustainability about a lot of that work, particularly the sort of wraparound support kinds of services that are necessary there, and whether is that granted out or is that how does that those funds come directly from the Department of Health to the person in the unit, correct? It's not. It's through a third party. It is, okay.
So we have several different pots of funds from HUD that run through CSD. One of our funding streams is ESG, Emergency Solutions Grant. And those funds are used as a preventative measure. And so those funds, if you have an eviction or you're having a hard time and you can provide information as to why you can't pay your rent, then we're paying those landlords directly. And that is a little over $200K that we receive in that small amount. And then through CDBG funds, we grant those funds out to grantees, and all of that is listed in our HUD action plan.
I see.
And then if we make changes to that, that comes in front of the body as to when we reallocate those funds and what that purpose is.
That's helpful. Thank you.
Okay, I know we gotta wrap it up. So just a quick update on crisis care. We did a pilot project this summer. We'll be able to bring the data to you I think at the Public Health and Safety meeting is where we'll do that. But the good news is we definitely increased encounters and connections, and also kind of just oriented some of our teams more to addressing the needs of people who are in public places and on streets. And so I think that's really going to carry over into just our ongoing operations. As I mentioned earlier, we're working on a coordinated outreach hub for the HOPE team. Sala's been doing great work doing mobile clinic. That's really more about physical health needs, but also connecting people with behavioral health at shelter sites. We talked about the safety patrol. We have planning for medication assisted access to that underway through mostly through the fire department, but our whole crisis response work group is working on that. And then I know I keep telling you this data dashboard is coming soon, but it really is. So yeah, we'll see that soon.
Looking forward to it.
Okay, and then just I think I've touched on most of this or a couple of these things already. I want to tell you something super awesome that we're working on with Kenny Peterson, who's here. We are going to be launching what we're calling a Good Neighbor Fund. I think many of you are aware that we have some community members who have been involved with our HOPE team, with RRS, and really make a difference for people experiencing homelessness in very tangible ways. That can be sometimes a couple nights in a hotel. It can be a plane ticket home. It can be the fee that it costs you to get your driver's license. But these are like kind of finite expenses that we can't cover through our other funds, but that absolutely make the difference and are a big part of diverting people out of homelessness. So we're now kind of really taking that to scale. We've established a fund at the Alaska Community Foundation, and we're just about to get the final paperwork in place. This will allow other donors to put their money in there, and then the funds will go out in a similar fashion through the HOPE team, our RRS, and through Third Avenue NAV. Again, to just kind of grease the wheels, fill the gaps for people and help divert them. So we're very excited about that. We'll be making that a public announcement soon, but wanted to let you know that that's coming. We also responded to a request for information from the Department of Health on the Rural Health Transformation Projects. This is part of the federal budget bill, and Alaska potentially stands to get quite a lot of money over the next 5 years. So we put in a proposal that does focus on our crisis response system, but also focuses on information sharing and increasing our connectivity with rural regions, and just kind of and increasing our connectivity with aging and disability resource centers. So just kind of pumping up what we're doing and expanding it. And then we're also putting a proposal together for the mental health trust. We've been talking about it for a long time, but I think we're actually going to do it now. So that'll go to them next month.
Thanks, Mr. Constant.
Thanks. So I know Kenny handed me a one pager. I can't find it here. I love the concept, and I love Kenny's been working on it a long time. And Kenny described kind of the methodology and whose names are on forms. There we go. Thank you. who makes decisions. I think that I'm gonna recommend if anybody who works for the Muni is in one of those positions, that they have a conversation with Paul Arvosti, just to make sure everybody's covered and it's all good. So just a suggestion.
Yeah, I think the way that it's set up there is it's a donor advised fund, or it's actually called a project fund, but we'll have a set of advisors who are mostly donors. So that's the goal.
I understand that, and
Yep.
I think though that as I heard, there might be some municipal people who are in some position of authority. And so I think it just would be wise, before you go much further down the road, for someone to sit down with Paul and have a chat about it, just to kind of vet some of the thoughts and how the hows and the whys. So I support it. It's a great concept.
Great. The only other question I have is around transports. And I know that we have certainly the MIT, is in this sort of new coordinated attempt at crisis care and MCT and MIT and Hope Team, that sort of thing. Has there been any change in terms of transporting people from point A to point B with Third Avenue net navigation? There's a lot of opportunity, I think, to get people where they need to go. And just curious if our transporting of people has shifted or changed or been rethought now that we're all coordinating in a different way.
Yeah, one of the changes MCT made during our outreach pilot that they're going to keep going with is that they can transport people now. They weren't doing that before, and they are starting to do that now. We also have the safety patrol will transport people, as I mentioned earlier. And then did you want to speak to our ideas around increasing transportation?
Sure.
Maybe it's like too not cooked yet.
So one of the things that we have been working on, especially with our shelter operators, is really how do we transport people either to and from shelters or outside of that location. In the past, we've used bus passes, and that's been written into the contracts, and the proposers have put forth how much it would cost. Really looking at, do we have other funding available, and what would that look like in order to increase the movement of individuals in our system outside of the Third Avenue Nav Center buses that the shelter operators currently use. And so we're currently working on that piece.
Thanks. I don't see any additional questions. Thank you so much for your presentation today. We appreciate it. Okay, next, we're gonna invite Jessica up from the coalition. I'll give you a second to get organized with your slides as well.
I'm gonna have to leave it at 3.
Okay. Great. It is warm in here, isn't it? I have to take off my jacket. Thank you for being here. Share your name for the record, and you can begin when you're ready.
All right, thank you so much. My name is Jessica Parks. I'm the interim executive director at the Anchorage Coalition to End Homelessness. And I thank you greatly for this opportunity to talk a little bit about the data and the information that we have about the people who were accessing the municipally operated shelters during the 2024-2025 winter shelter season. Go ahead to there we go. So when we look at the 24-25 winter shelter season, what we're talking about is from the time that first winter shelter or cold weather shelter was opened in 2024 until June 30th, 2025. So that's kind of the group, the time frame that we're looking at there. We had 5 shelters open during that time frame. We had 2 of them located at the Alex Hotel. There's 2 buildings at that hotel. So one was operated by Henning, one was operated by MASH. We had the 56th Avenue shelter, which of course had been running as a year-round shelter at that point. So we just picked it up during that season time. Downtown, Henning was operating the Henning House at the former Henry House location, and then a block of rooms as a shelter at the Merrillfield Inn. So we had a total of 532 beds that were in operation during that time frame. Next slide. So when we look at the number of unique individuals served during this time frame, we served 2,256 unique individuals across all 5 of those sites. And then this is a little snapshot of where were they before they came to the shelter. And so for people who may have come more than once, this is the first time that they came to that shelter. The majority of them came from outside. So in HUD speak, we call that place not meant for human habitation. You've heard us mention that before. But that means someone who was sleeping outside, in a tent, in a car, in a shed. Something like that is what's captured in that outside. We had 831 people who came from another emergency shelter. So they may have been staying at a different shelter and then come into one of these shelters. That happens a lot, moving people between shelters. Sometimes people need to be in a different area of town. They may have a job, they may have family support, something like that in a different location. Or they may just have needs that can't be met at that shelter. And so they'll move to a different shelter. 206 came from a temporary or a transitional location. So this might be a transitional housing program. This could be someone who is staying with family or friends, but not permanently. So they weren't on the lease, they were couch surfing, something like that. 85 people came from an institution. So that would be a hospital, a jail, something like that. They exited from that institution into one of these 5 shelters. And a very small number, 32 out of that 2,256, came from some kind of permanent situation. So they may have been housed, lost that housing. They may have been in a roommate situation and had to leave that. But it was a permanent situation that they then came to one of those shelters. And then at the bottom here, we looked at some data about those stays. So the median length of stay was 22 days across all of those shelter stays. But the piece I really want to highlight there is that we had 849 of those 2,256 people that had been experiencing homelessness for 1 year or more. And almost 500 of those 849 had been experiencing homelessness for 2 years or longer before they came into this shelter. So we have a lot of people accessing our cold weather shelter system that have been outside. They've been experiencing homelessness for a really long time in our community. This is a breakdown of some special populations that were served in our cold weather shelter season this year. We had 111 veterans come through those shelters. And of those 111, 40 of them would be what we classify as chronic veterans. To be considered chronically homeless, that means you are experiencing one or more disabling conditions, and you have either been experiencing homelessness for more than 12 consecutive months, or you have had more than 12 or more than 4 experiences of homelessness, episodes of homelessness in the past 3 years. We served 182 transition age youth. So those are youth that are between the age of 18 and 24. And we had 575 people who reported being survivors of domestic violence or sexual assault. And out of those 575, 106 of them had had that experience within the last 3 months. So it was a very recent, they're either actively fleeing or it had just happened to them.
I have a couple questions for you.
Okay.
Mr. Yorker, and then I'll go to Mr. Constant. Oh,
No,
okay, then Mr.
just a
Constant.
recommendation. I would suggest a relabeling of that box that says chronic veterans. Your box clearly can hold more text, and what I think you mean is chronically homeless veterans.
Yes.
And so I think it communicates something different than you
Okay.
intend.
All right, this is a breakdown of the ages of those clients that were served. So again, the transition age youth up at the top there, and then a breakdown between each 10-year kind of category going through there. You can see the vast majority of the clients are between the ages of 25 and 54, but we did have 142 people that were 65 or older that accessed the shelter. So out of those 2,200 unique individuals, 142 meeting that age criteria of 65 plus. And just as an aside, one thing that we do as a system when we have people experiencing homelessness that are over the age of 62. They do qualify for subsidized senior housing through Alaska Housing Finance Corporation, Cook Inlet Housing Authority. So we try to prioritize getting them on those wait lists for that subsidized housing, along with other supports that might be in place. But those are something that they qualify for at that age. Next slide. This is just a breakdown of self-reported disabling conditions. So part of that intake and part of that assessment that's being done, we ask a lot of really personal questions about someone's disabling conditions. These do have people who may be reporting more than one of those. So if you add up all of those percentages, it will not equal 100%. So 41% or 935 of people accessing our municipally operated shelter reported having a mental health disability. Alcohol or drug use, or both, was 582 or 26%. 25% report a chronic health condition. That can be anything from diabetes to congestive health failure. A small number, but a number of people reported HIV positive or AIDS. 16% report a developmental disability, and 28% or 624 people report a physical disability. Sometimes when we see the moves between different shelters, it is because of a physical disability. We might be moving someone from a shelter that has stairs, for example, to a shelter that has space available on a first floor or is a little bit more accessible. Next slide. And then looking at the exits from shelter, one thing I do want to highlight is the bottom number. I'll start at the bottom and go up. That we had a little over 1,000 of those exits were just marked as to an unknown destination, or there wasn't an exit interview done. So I do want to highlight that this is of the exits that that were reported or that we knew. 208 exited to a permanent situation. That could be permanent housing, so a rental or an ownership situation of their own. It could be reunited with friends or family in a permanent situation, which would mean you would be on the lease. You know, you have that security with that. A transitional situation exit would be some of those same types of things to a transitional housing program or to friends or family where it is not a permanent destination for you, but it is housing. 56 would be exited to an institution. Again, those are hospitals, jails. One thing that is categorized in there would be things like long-term care facilities. 315 exited to another emergency shelter. 253 exited to outside or a place not meant for human habitation. And then, as I said, just over 1,000 unknown. So it is challenging when we don't have that information. It's very difficult sometimes in these larger shelters to get that information as people are exiting. You don't always know when someone is walking out the door. Is that them walking out the door for good? Or is that them walking outside to have a smoke, to chat with some friends? By having a strategy to have smaller shelters, you'll be able to get better data around exits. You will have just fewer people walking in and out of the door to be able to have those conversations. And that was it. Did I miss anything, Thea and Kim, that you want me to highlight? Okay.
Ms. Silver, do you have a question?
Yeah. So my question is around some of the permanent and transitional housing that people are exiting to. What is your average vacancy rate on housing that's available to serve unhoused individuals? So for example, you have a housing unit that has come up, but you have pulled a name from the top of the list and you're looking for that person and you can't find that person. So what is that average vacancy rate? And how long are these units staying vacant?
So exits that are through coordinated entry, which is what you're describing, it can vary. I can't tell you the vacancy rates. That would be each individual program. would know that information. I've seen referrals from the time the referral is accepted to the time the person moves in be as few as 10 days, and I've seen it go as long as 3 months. So really it depends on how document ready that person is. Most of these housing programs at a minimum are going to require that you have an ID, that you have some way to verify your social security number, whether that's a social security number card or a benefit statement, something that has that information on it, as well as a verification of disability. So sometimes it can take some time to get those documents together.
Okay, so in some cases, you're holding housing vacant for 3 months while you're waiting for somebody to get an ID or something like that.
Yeah, it would be the individual programs. So it would be like Rural Cap, NeighborWorks. But yes, sometimes they could be held vacant that long.
But they're required to pull that name off the coordinated entry list and hold that available.
They are required to fill their vacancies using a coordinated entry referral. They would have their own internal policies on how long a referral stays open, how long it takes to do some of that.
Okay, thank you.
Yes, Ms. Baldwin Day, then Mr. Constant.
Yeah, thanks, Ms. Parks. I'm curious about some of the numbers and how they relate to one another. So, the number of unique individuals served 2,256, and then adding where people stayed before coming to shelter, all of those numbers add to a different number, and then the numbers for the numbers that pertain to ages of clients adds up to a different number. So I'm curious which of those is the most accurate number.
So then the people, where do people stay before coming into shelter? That's going to capture, some people came more than once. Some people may have had, 5 or 6 unique stays or entries, I would say, into one of those shelters. The age number, some people don't report a date of birth. I did not include that number on there of people who didn't report a date of birth or that their date of birth wasn't collected.
Gotcha. Okay. And then I think you said that this is data that is related to municipally operated shelters. This does not include other shelters that are not operated by the municipality. Do we actually have like aggregate data for all shelter operators who are doing this work in the municipality?
If they are using HMIS, our homeless management information system, then yes, we could pull that information across any of the shelters that are part of that. We do have 2 shelters that do not use our HMIS system in Anchorage right now, though.
Okay.
And just to add to that-
which are those?
The Gospel Rescue Mission, Anchorage Gospel Rescue Mission, and the Downtown Hope Center Soup Kitchen.
Okay. And then I think anecdotally, I have heard that there are shelter providers that use another system, but they also use HMIS in addition. Is that correct?
Yes, there are some I would say there's probably multiple providers in Anchorage that use a separate database to track program-related data. So they may have a program where they're billing Medicaid, for example. So there are some shelters that do track other data in a different database.
Gotcha. So this is really just partial understanding of what's actually happening with regard to homelessness or shelter utilization in Anchorage.
Yes, it's a snapshot of just the municipally operated shelters.
Okay, awesome.
And Ms. Baldwin Day, I think Thea would like to jump in. Maybe she can add some.
Yeah, so this report, you remember at the last committee meeting, RRS kind of gave their report of last year's cold weather shelter. And so we wanted to follow that, which is kind of the qualitative report with a quantitative report. So we wanted to kind of wrap up what happened last year, give you the information. As I mentioned, we're working on this dashboard for you. That will somewhat be organized in the same way that graphic that I put in the slide is. So we'll be able to look at the shelter programs that we're 100% operating, the ones that we're funding, and then the ones that participate in HMIS but that we don't fund. So we'll look at those. You'll be able to see those as groups within that dashboard.
Gotcha. On the slide that pertains to exits from shelter, how many, I mean, so these are exits. Do we have any data on like re-entry? So let's say you have 208 people to exit to a permanent situation. Do we know how many of those 208 might return to shelter in the same year, or who go to an institution but then come back to shelter? Is there a way to envision the loops that might be happening and to understand both outflow but also like re-inflow?
Absolutely. And we call that returns to homelessness. If somebody exits to a permanent destination and then returns to homelessness within the next 24 months, that would be we would track returns to homelessness, and we can do that. That is something we can do.
Is that something that could be sent to interested members, separate
Absolutely.
from this
Yes.
presentation? Yeah, I think that would be really, really helpful, really interesting to see how that cycle works and what our true outflow is versus recirculation. I think that'd be really helpful to understand.
Absolutely.
Mr. Constant.
Just a couple of questions before I have to run out. So, how do you define exit from shelter?
I'm sorry.
What's
what
the
was that?
definition of exit from shelter? I
Um,
understand there are all these various places people go or kind of why, but what does it mean?
So in this situation here in exit is they left the shelter, like we have a program in HMIS, and so they were exited from that program. So the conversation about they missed 2 bed checks, they were exited from that. To truly exit homelessness though, you exit to a permanent destination.
Right. So, okay, that's helpful just to understand that this is kind of a narrower definition than kind of.
Yeah, it's exits from the shelter programs,
Got it.
not necessarily an exit from their homelessness.
Understood. And then, so to your point, Ms. Silver, is about how providers are holding beds open and someone might be there. This gets into one of the difficulties of the treatment provision. Like people who seek therapeutic treatment, whether it's behavioral health, mental health services, or in particular, substance use disorder services that might take 90 days, 5 months, and they're housed before, or they have some kind of circumstance that categorizes them as housed. If they're going to avail themselves of a therapeutic intervention that puts them in a residential program, they effectively lose that housing and then are in a position where, as they're trying to figure out their way out of a therapeutic program, have to identify a housing situation for themselves to successfully leave. And so there's actually risk involved in going into a therapeutic program to get help for permanency in your kind of illness, because it might put you at risk for housing, because if we don't do that, we will always have some differential that's a meaningful amount of either money holding beds open where someone else can't go, or people becoming at risk. It's a unique and confounding problem.
Just to speak briefly, that one of the providers that's operating in Anchorage, they're operating they're one of the newer providers is operating what's called, it's kind of a wonky name, partial hospitalization program. And what that means is you're basically engaging in a similar level of treatment programming during the day as you would in a residential setting, but you're living somewhere else. And so that's one of the options potentially for micro units, is that they could provide that kind of sober housing and people could be engaging in partial hospitalization during the day or other types of intensive outpatient. So I think that's a really good point.
We've been working on fixing that problem for a long time, and it is confounding as all heck, but we have a solution, not the solution, but a solution coming. Thank you. I'm sorry, I have to run.
Good. Anything else you have to add for your presentation? I just wanted to just highlight a couple of things that I think stood out to me. One is this number that 849 people experiencing homelessness a year or more, and then 500 people 2 years or more. And it for me, that changes these inflows and outflows a bit, in that there seem to be a group of people that are moving from shelter to shelter or moving in and out of homelessness for a, there is a population that is experiencing homelessness for a longer period of time. And then there's another group that coming in and coming out, right? And so it's interesting to think about how we're addressing those folks in different ways. So that's the one piece that I think is helpful to understand is how different this population is. So you can respond to that if you want.
Yeah, I will Lifeline phones. So GCI and a second provider out there being able to help people sign up for Lifeline. We have haircuts, foot care, healthcare providers, all sorts of things. So if you have not signed up to volunteer and you want to, it is not too late. Let me know and we can slot you into a spot. Or if you just want to come down and see what's going on, come on down.
Thanks very much, and thanks for being here today. Okay, we're going to move on to our public comments. Do we have people in the audience who would like to speak at this time? Okay, so we can set up the microphone. Come on up. You'll have 3 minutes to speak. There'll be a timer up on the screen there. Why don't we have the first person just come on up, and we'll set up a little chair for you here to sit down. All right. Welcome. Share your name for the record, and you'll have 3 minutes. And hit the little button on there until the light turns green. There you go.
Thank you. My name's Kenny Peterson. And I was just looking at my emails and I realized that I've been at Homeless Solutions for 16 years when I first started with L.V. Gray Jackson and Take Back Our Park. And so this Good Neighbor Fund is what got me off of my chair at my place of work. I was looking down from my desk to the folks on the street corner below our office, and I thought, what can I do to help? And I recall that you had the same question when you were going over the recent ordinance about arresting folks, that you took 6 hours of time for people to say there's a better solution. That's what I looked for 16 years ago. I think that this Good Neighbor Fund is the response to that. And I'll share it in this context. There was something I read about 14 years ago that says, that's it, that's the solution. And it was related to a concept called fast offerings, which we use in our church to help take care of needs. And so if you'll indulge me, I'd like to share what started me for it and why I think the Good Neighbor Fund is a great idea. In particular, the question is, what can everybody do? And this is what everybody can do to contribute. It's a 2,500-year-old statement. It's from Isaiah 58. It says, is this not the fast? A fast is to go without food and drink voluntarily for a certain length of time. And a fast offering is to give the value of those funds to help care for the need. Isaiah 58, 6 through 11 plus 12. Is not this the fast that I have chosen? To loose the bands of wickedness, to undo heavy burdens, to let the oppressed go free, and that you break every yoke. And this is where it ties into homelessness and what we're going through. Is it not to deal thy bread to the hungry, that thou bring the poor that are cast out to thy house? Build a relationship. That thou seest the naked, that thou cover him, that thou hide not thyself from thine own flesh. And then the promises, and I saw this is for our community. Then shall thy light break forth as the morning, and thine health shall spring forth speedily. Thy righteousness shall go before thee. The glory of the Lord shall be their reward. Thou shalt call and the Lord shall answer. Thou shalt cry, he shall say, here I am. So you have a connection with God, or with higher power, as you will. If thou draw out thy soul to the hungry and satisfy the afflicted soul, then shall thy light rise in obscurity as a community. Thy darkness be as noonday, which is really good in Alaska, in the summer. And the Lord shall guide thee continually, and satisfy thy soul in drought, and make fat thy bones. Thou shalt be like a watered garden, and like a spring of water whose waters fail not. And then I was taught that there's another verse 12, that I didn't know. And verse 12 says, and they that shall be of thee shall build the old waste places. Thou shalt raise up the foundation of many generations. Thou shalt be called and the repairer of the breach. and the restorer pass to dwell in. So I believe that this will actually bring together everyone on both sides by giving up a little bit and helping out. And so this is what got me off my chair 15 years ago. It got us officially established a week ago. And there's a flyer here for it, but I'm really excited. So
Thanks. Thanks so much for being here today. Thanks for your comments. Okay. Oh, yep. No, actually, sir, just a second. Come on back. We got a quick question for you, Ms. Silvers.
did you want me to repeat it all again? I could, no.
First of all, thank you for the work that you do in the community. And I just actually kind of wanted to make a comment. Covenant House has kind of a similar program to the Good Neighbor. Have you talked to them?
I talk to them all the time.
Okay, it's
Absolutely.
been very successful. So I was very excited to see
Yeah.
that today.
Yeah, and in fact, one of the things that I say on here is that whoever your trusted organization is, give to them. And if you want to do this outreach to the tip of the spear, the folks who are out there, this is a nice alternative as well. So this doesn't take away from anyone. Do that as well, or do that instead. All's
Yep.
good.
All right. Thanks. Okay. Next up, please. All right. Share your name for the record and you'll have 3 minutes.
Sure, Roger Branson, I'm District 3, a longtime mental health advocate, and I came about that quite organically. I just wanted to talk about how pleased I am to see the data that's available to you guys. There was a day when we didn't have reliable data, or the data only resided with the individual providers who used it for their own needs. And here we are with the HMIS, and that Thea was talking about, the other 2 shelters. They're going to be able to congregate that data so it can be observed. And ICA does an awesome job for and with AKHMS gathering the data. And I'm very pleased to see the depth of questions that you guys were asking about that data. And I want to encourage you all to keep doing that, to set the paths that we can track, because with this data, with this database, we can track over 10-year periods, we can track over shorter periods, longer periods, and establish it going back. And so the things that are important to you guys to keep watch of are also the things that are important to the community.
At risk for homelessness, and we could really use some help. We have a furniture bank that we have been operating for over a year with no support. We have served over 100 families with free furniture with no support. So our services are prevention services. And I'm just hoping and waiting for self-sustainability to become a priority. Thank you.
Thank you for being here today. Thank you for your comments. Okay. Next up. Welcome. Share your name for the record. You'll have 3 minutes.
Okay, Jamie Lopez, East Anchorage, formerly Coalition, formerly Homeless, unprepared remarks. Mr. Peterson, you stole my thunder. So, yeah, where am I going to go with this? I don't know. Lots of different things to talk about. I'm concerned. So this, it's sort of the land of make believe, and I don't mean that in a rude way. But there is a very, very large disconnect between people that live in houses and those that are outside. And even so far as, the response, the planning, the execution, how fast you go, how slow you go, people get up the next day. Hey, it's just another day. But time matters out there in the amount of people that live, die, or, lose fingers and toes. And so what I'm seeing today is not a plan, because the plan should also include how you support the people outside, how you keep them alive. You need, water at least every 3 days. You need food. A human being can support on Earth. They can live without food for approximately 3 weeks. And so similar to what I sort of discussed in an assembly meeting a few weeks ago, when you remove sources of free stuff, people take more. Because they have to, and they have to survive. And it's no great mystery why the amount of homeless camps and civilization tend to sort of congregate and grow around supermarkets and grocery stores and convenience stores, because those are places they can get food. Similarly, people need electricity, they need heat, and they need places to go for that. And so similarly, libraries and such. You have AO 2025-74S2 with maps that are supposed to tell people where they can and can't go. Half these people are in the Stone Age. They can't even charge their own phones, or they don't have phones at all. And so the police are handing in these cards and saying, follow these cards. And meanwhile, they don't have access to anything. Yeah, The maps, they say they're for informational purposes only and no legal binding. There's a woman I ran into yesterday. I've known her a while. And so she's out in an area. On the map, it says it's perfectly acceptable to be there. Police visited her a few days ago and told her she had to leave. And she said, okay, where am I supposed to go? And by the way, it says on this map that it's perfectly okay. Oh, it's illegal to camp anywhere on public land. And she has to speak to the Hope team and be linked to them. And this is not the first time that I've heard this, where the police officers, so on one hand, you have the Hope team ladies doing some good things. And then on the other hand, you have the chaos and despair of the rest of, certain people that are endlessly displacing people. And so, once you see the hope, then the despair is eventually coming, typically because they're linked, but also because these people, the enforcement side, are not actually trying to link things to people. There's one other thing. If you're not able to charge your own phones, how do you, access the maps? And somebody went over to Lions Club recently and was telling them they're going to siphon power. And I had to talk to somebody about this, and clearly, no, the police officer said you can't use the charging port to charge your phone. So again, how do you access the maps? All right.
Thanks for
Sorry,
being here
a bit of a
today.
hot mess today.
Thanks for your comments. Anybody else would like to speak at this time? Oh, sorry. Anybody else? I see potential movement. Nope. Yes? Yes, sir. Okay, I don't want to try to convince you. Just might want to make sure we don't leave anybody out. All right, share your name for the record and you'll have 3 minutes.
So my name is Dave Kuiper, and I am with Christian Health Associates. And two things: I'd like to thank the group and the city for the support that you've given to us as we sought to provide emergency cold weather shelter for families over the last several winters. And been desperately trying to verify the data that I've got here to report it accurately. But this last year, this last season, we served 32 non-duplicated families in our single site that we operate, and 74 families in the hotel, in a hotel overflow that we have rented. That's 108 individuals in the single site and 247 individuals in the hotel. And housing exits from the hotel were 41 persons that exited to housing, and out of the single site, 58 individuals were exited to housing. Those are for the months of October through April of 24-25. And we're gearing up to get started in October once again. So thank you.
Thanks so much for being here. Thank you for your comments. Anyone else before we close the meeting? Okay. Oh, yep. Come on up.
Phil Cannon. I live in Mountain View, and I wasn't planning on saying something except for Kenny was like, go. Couple of things. I think overall, I just want to share my optimism, I guess, at the way that the system works. I know it doesn't work perfectly, and it doesn't work perfectly for everybody. But if you listen to what Kenny said here at the microphone earlier, if you listen to what Jamie said just now, and what Jamie says at every public meeting, if you talked to Kathleen last week after 2 people were murdered in the park, in Davis Park in Mountain View. And what I think the thing that encourages me is to say we have a system that is working, not working, whatever, but the system is compassionate, and I'm really proud of that. Like, I think that we have a city who really does care. We have a lot of people, from private individuals putting together funds to private individuals who bring food to homeless people every single day, walking, who volunteer at food banks, who come and publicly advocate for things. And even those in charge, those with authority, those with power, are asking hard questions, when difficult things happen, like how do we stop this from happening again? And I think that's worth just saying out loud and saying, like, we have a compassionate system, and I think that's good.
Thanks for being here. Thanks for your comments. Okay, last call. Seeing no one, thanks everyone for being here. Thank you for your work. This meeting is adjourned.